It's late, you're on your phone, your knee is bugging you again, and you've typed some version of this into the search bar. Does PRP actually help arthritis? How long does it even last? What are the downsides to PRP? Maybe somebody already told you it's just arthritis. Rest it, ice it, take some ibuprofen, come back when you're ready for a replacement. Something in you went, that can't be the whole answer. Well, if that's you, you are in exactly the right place. Hi, I'm Dr. Erin Wos. I'm a sports medicine physician right here in Eugene, Oregon, and I sit across from people asking these exact questions every single week. So let's go through them the way I would if you were sitting right across from me. Here's the first thing I want you to know. An X-ray or an MRI, these are just photographs. They are not your future. We treat humans, not images. So whatever that report said about your knee, your hip, your shoulder, even your thumb, you are still the person who wants to hike, to lift, to chase your kids or grandkids around, to get back on the starting line. You're still an athlete. We just need a real plan. So let's talk about whether PRP can actually help you stay in the life you love. 6 common questions I get every day. Let's go. Question number 1, does PRP help arthritis? The short, honest answer, for a lot of people, yes. And the strongest evidence we have is for arthritis of the knee. So let me back up and tell you what PRP really is. PRP stands for platelet-rich plasma. We take a sample of your own blood, thin it down, and concentrate the platelets, which are basically little packets of growth factors and healing signals. And then we place that concentrate right into the joint using ultrasound so we know exactly where it's going. So here's how I explain what it's doing. In a joint with arthritis that is worn down, the body has kind of stopped getting the message that this area still needs attention and healing. So PRP delivers a concentrated dose of that signal. It creates a tiny controlled stimulus that essentially restarts the healing process. So I describe it as like restarting that signal. And the research backs the experience I see in clinic. In mild to moderate arthritis in the knee, good quality studies show PRP meaningfully reduces pain and improves how the joint functions. And those benefits have held up out to about a year. In several head-to-head studies, it actually outperformed cortisone and gel-type lubricant or visco injections, especially the longer out you look. So, does it help arthritis? For the right person, it really can, which brings us to the next question, and this one is an important one. So question number 2. Who is not a good candidate for PRP? So I want to be straight with you because this is where so many people get sold something that was never going to work for them. PRP is not magic, it's not a panacea, and it is not for everybody. Keep in mind, it tends to work best for mild to moderate arthritis, where there's still some joint space left to work with. If your joint is truly end stage, completely bone on bone, PRP is far less likely to give you what you're hoping for. And an honest conversation about other options, possibly seeing a surgeon, serves you better. So a few other situations where we have to consider alternatives, obviously an active infection, certain blood clotting conditions or blood thinning medications, and expectations that PRP is going to grow you a brand new joint. It just won't. It is not a cure for arthritis, but it is an effective tool to calm a joint down, improve function, and help you keep doing what you love. So this is exactly why I won't tell you over the internet whether you're a good candidate. That's what a real evaluation and consultation is for. Looking at your joint, considering your prior history and imaging, looking with the ultrasound machine, and at you, the whole human, not just the picture. So question number 3, what are the signs that PRP is working? So this one trips people up. So I try to set the right expectation for patients. PRP is not cortisone. Cortisone can feel great in 2 to 3 days, and then over time it fades, like in 6 weeks to 3 months. PRP works differently because we're not masking anything. We're stimulating a repair response. So here's what the timeline typically looks like. For the first few days, a lot of people actually feel more sore, and that's normal. That's the controlled stimulus doing its job. Then, over the next several weeks to a few months, that's when people start noticing the real shift. Sometimes that post-injection soreness is calmed down by the other treatments that we do. So the signs I ask about over the long term: are you reaching for the ibuprofen less? Is the morning stiffness easing up? Are you getting fewer of those flares after a long day? And the big one, are you doing more of the things you'd started to avoid? The longer walks, the stairs, the round of golf. Those are the wins that we're after. Occasionally, I've had patients say they weren't getting better, but when we dug deeper, they noted that they were walking further, they were sleeping longer, and doing their activities with less or even without pain. So it is gradual and it builds. Keep that in mind and don't judge it at day 3. Question number 4, how long does PRP last for arthritis? So the honest answer is it depends, but let me give you a solid range. In the studies, the benefits are reliably documented out to about 12 months. In my clinic, many of my patients get 12 to 18 months or longer of relief. So what makes the difference? A few things. How much arthritis you started with, your own biology and how well you recover, the quality of the PRP itself, concentration, preparation, these things really matter. This is not all the same stuff. And whether we paired it with the other pieces, management of the joint, as well as shockwave and laser to support the tissue. So think of PRP less like a one-time fix and more like we're tending a garden. We restart the growth and then we keep showing up for it. So question number 5, what is the success rate of PRP for arthritis? So I want to answer this carefully because I don't like to throw around guaranteed percentages because every human is different. Here's what's true and what I know. In mild to moderate knee arthritis, the majority of appropriately selected patients get clinically meaningful improvement, real reductions in pain, and real gains in function. And I have seen this a lot in my clinic. However, success isn't random and it isn't luck. It comes down to many details. Choosing the right candidate, using high quality PRP, placing it precisely with ultrasound, and backing it up with smart rehab, nutrition, and other treatment. If we get all of those right, then you've stacked the odds in your favor. If we skip those, then the results can be a lot more hit or miss. So the real question isn't what's the success rate, it's am I being set up to succeed? That's the part that you have control over, which is great. And what I love to help patients with, because that helps you feel empowered about your decisions that are about your body and your health. So question number 6, what is the downside of PRP injections? Okay, the catch. There aren't many downsides, but they are worth mentioning. First is cost. PRP is not covered by insurance, so it's an out-of-pocket investment. And that's real, and it's worth weighing honestly if you're considering doing a PRP. Second, that soreness that I mentioned, a few days of achiness after the injection, is common. Like any needle into a joint, there's a small risk of bleeding or infection. Those serious problems are rare. And because we're using your own blood, there's no foreign substance and no rejection risk, which is one of the things I genuinely love about it. And third, the most important caveat, the research on PRP is genuinely promising, but it's still mixed. Studies prepare it differently and measure it differently, so many major guidelines remain cautious. I'd rather you hear that from me than feel oversold later. PRP is a strong, well-tolerated option for the right person, but it's not a guarantee for everyone. And that's the whole picture, the good and the honest. So if you've been sitting with arthritis, feeling like your only choices are grin and bear it, or continue taking ibuprofen, or wait around for surgery. I want you to know there's more in between. Here's how we'd actually do this together. You come in for a consultation. We look at your history, your prior imaging, joint on ultrasound, which is performed by me. We look at you, your goals, your life, what you're trying to get back to. We build a personalized plan, we treat, and then we reassess and adjust if needed. No pressure, no hype, just a real conversation about whether this is right for you. Because as we collect days on this earth, the goal was never to slow down and give things up. The goal is to stay in the life you love. You're still an athlete. Let's keep you in the game. If you want to find out whether you are a candidate, the link to my website is right below this video. And if you have a friend who's been told it's just arthritis, send them this. It might be exactly what they needed to hear. So I'm Dr. Wos. I'll see you in the next one.